Welcome to this section on the cervical spine. Make sure you review the upper thoracic spine video or videos because that is the base to the cervical spine. The upper thoracic spine and the upper thoracic ribs are very much like the pelvis of the low back. It's the base of the neck. So make sure you review those videos if you're uncertain about those techniques. So we're going to go over some really exciting cervical spine techniques. I know you'll find it interesting and exciting. And if you want even more education, remember that we do have the mastery section, and that has very high level, wonderful moves that will blow your mind in many cases because they're so effective. So let's get into the cervical spine. So if you recall, we take our index contact and put that on this firm spot in the upper back, which is the second thoracic rib. And we make a contact and take her gently to tension. And after about 10 to 12 seconds, there'll be a release. And that's the release of the upper thoracic spine. And you want to do that before you work on the cervical spine. That's very, very important. Now, remember that in most patients who've had injuries, there is a reverse cervical curve. It should be an anterior curve, and often it's flat or reversed. So this is a great way to help improve the function and structure of that area. So I'm going to use my pisiform bone or my index, and I'm going to palpate by putting Julia through a little bit of extension. And here I find a little tight spot. So just very gently tilt your head back. That's good. And then relax. Perfect. And then, of course, I go to the opposite side and palpate, and that does feel looser. Now, one way that some people find effective is to use the pisiform bone instead. So I can take my pisiform bone in the same place, the very posterior aspect of the transverse process, and hold it, and after about 10 to 12 seconds, what we call ligament creep occurs, where the ligament stretches and then we get release. So you don't have to force it. After 10 to 12 seconds, there will be some creep and release of that ligament and joint capsule. So wait about 10 to 12 seconds, and then there's a release. When you're working with the cervical spine, you not only want to work in the area of the posterior aspect of the transverse process, but also the anterior. And that's because both are very involved, especially with the cervical spine where there's so much range of motion. So I'm going to use my thumb, I'm going to rotate her to the side I'm treating, and I'm gently going to palpate along the spine. And I can feel right there. Feel that, Julia? That is your atlas, and that's very tight, so that's C1. So I'm going to tell you now to gently turn your head to the left. There we go, and that's going to release. And let's go to the other side, and here we do have a little problem here in this lower cervical spine. You can feel that. So we hold that and gently turn to the right. There we go. Let's just do this side one more time since that's a little tighter, and turn to the left. Good. So I'm just using my thumb on the anterior part of the transverse process of the cervical spine.